Good evening. Hi. Thanks very much for the invitation to speak here today, and thanks to all of you for being here on this beautiful fall evening. It feels like summer. Um, I'm so happy to see this room so full tonight because it just goes to show how little by little we're bringing more and more attention to this very important issue of cardiovascular diseases and cardiovascular health of women. So thanks for being here, and I hope that through the course of the evening you can now take one or two little pieces of information that you learned today and you find it important, maybe it affects you in some way or maybe affects somebody you know, and bring those couple of pieces of information to your circle, to your family, to your friends, and make sure you share that. Because really, bringing awareness to this issue is the first step towards building a healthier community. So with that in mind, I was asked to talk about cardiovascular diseases across the lifespan of women, which definitely would take me the whole day to do, which I won't do. So instead of doing that, I decided to focus on a few specific issues that may affect women of different age groups. These are issues that I think have important messages that I can share with you. So I took the liberty of narrowing the topic a little bit in that regard. But before we go there, let me just share with you some basic general facts about sex disparities or cardiovascular differences in women, especially when it affects cardiovascular risk, because I think these facts are nice eye-openers to really bring you up to speed about the problem that we're facing here. So, for starters, if we go out there in the streets of Ottawa or anywhere else in Canada or even in the US, and you ask 100 women, what do you think is the biggest threat to your life or to your health? What do you think most women will say? Everybody's saying breast cancer. That is true. His research from Canada and in the US has shown that anywhere between 30 to 46% of women will respond that way. They will say, breast cancer is the biggest threat to my life and to my health, when in fact it is cardiovascular disease. And I'm not saying this to minimize breast cancer, but just to bring your attention to this important issue, because if we don't know what is the biggest threat to our lives or to our health, how can we even have it on our radar? How can we act upon this risk? How can we modify it, right? In fact, if you ask those same 100 women, only about 4% of them will say cardiovascular disease correctly. And when it comes to this notion of perceiving our own risks, research by our own Lisa McDonald, who's sitting here, who speak after me today, has been really an eye-opener in that regard. This was one of the first activities by the Women's Health Center, and Lisa and her team performed a survey throughout Canada among Canadian women to really get a sense of what is the knowledge about cardiovascular risk factors and manifestations out there, and really get a sense of the knowledge gaps in Canadian women. And the results were really eye-opening. Not only did they find that women's knowledge of cardiovascular risk factors and cardiovascular manifestations was poor, but also among those women that had the highest risk for cardiovascular disease, 60% of them actually thought their risk was low or moderate. So they were really underappreciating their own risk. So that's why I wanted to start with this very simple concept, because I want to encourage all of you, men or women, to know what your risk is. And all of us are under some risk, some more than others. And one way that you may choose to do that is, of course, to talk to your healthcare provider and have your risk assessed, and there are calculators that can do that for us. The other alternative as well, or a complementary alternative, would be to use reliable sources of information, and I can direct you all to our Women's Health Center website. It is www.yourheart.ca. I don't know if any of you have used it, but it's very nice, and it has a wealth of information about cardiovascular risk, and you can see the ones that apply to you and go from there. Through the website, you can also access our virtual care platform, which is a very nice platform that is available to men and women, where you can actually, again, have a more individualized assessment of your risk with a plan to conquer those risk factors and improve them and so forth. So I'm sure Lisa will talk about that later as well. So after these introductory comments, let's then shift our attention to women that are young or middle age. And I'm not going to define here by numbers what is old and what is middle age. I'm just going to leave that to your interpretation. But starting with this concept of cardiovascular risk in low to middle age women, definitely young to middle age women are somewhat protected against the most common forms of cardiovascular disease, which are heart attacks and stroke. That is because during our reproductive life, we have estrogen, and estrogen is a very good hormone for us in that regard, in the sense that it keeps our blood pressure at check, it keeps our blood fats and cholesterol at check, and it helps keep our arteries healthy. But despite this, there is still a risk of having heart attack and stroke in our early years. So what are some of the most important risk factors in this particular group of women? And this is something that I wanted to share with you today. First of all, let's talk about physical activity. This is all research-based, I'm not just making it up. So among women who are younger than age 40, if they have poor physical activity, if they're very sedentary, they don't exercise at all, their risk for having a heart attack is actually increased threefold, or 300%, depending on how you look at it. Now, you have to remember that the risk is low to begin with, right, in the younger women, but it's still increased threefold just by not exercising, which is something that we have total control of. We cannot control genetics, but we can control the way that we move. So this is a very important message I wanted to leave with you today. Among young women as well, there's another very important risk factor for a heart attack, which is smoking. Now, let me ask you, I'm going to ask the group over here because it's more focused. So what do you think is the increase in risk for heart attack for women younger than age 40 who smoke? I'll let you take some guesses. By 50%? What did you say? 50%? And higher than that? Okay, so there's a lot of 50%, maybe higher than that. It's actually 600%. So, yes, because women younger than age 40 who smoke, their risk of having a heart attack increases by sixfold. So if you know anybody in that situation, if you have any friends, family members who are smokers, this is a big problem with youth nowadays. You have to send this message to them because there's still time and they can really reverse those detrimental effects of the smoking if they quit. Another very important risk factor for heart disease and stroke in younger women is a condition called preeclampsia. Some of you may have heard about this. It's a condition that affects women during their pregnancies, usually during the third trimester. The blood pressure of the woman goes up, sometimes to very dangerous levels, and they can have problems in the kidney, in the brain, in the liver, and so forth. It's very dangerous for the mother, very, very dangerous for the baby. But once the baby is delivered, preeclampsia does resolve, and most women and their providers tend to think that once preeclampsia resolves, they can turn the page and move on with their lives and move on to the next chapter. When in fact, very few of them know, and that includes the providers as well, that once you have an episode of preeclampsia, your future risk of having a heart attack or stroke or even dying from these conditions go up anywhere between 2 and 10-fold. 2-fold for mild preeclampsia, increases 10-fold for severe preeclampsia occurring in the second trimester with detriment to the fetus and so forth. This is way more potent than a lot of the cardiovascular risk factors that we talk about in our day-to-day, right? And women don't know that. They think that that's in their past. So I wanted to also share this with you, because it's actually a fairly common condition. It affects about 8% of all pregnancies. So it's very possible that some of you here may have had it, or you know somebody who may have had it. And it's not a matter of, running to the cardiologist immediately because you're going to drop that tomorrow, but it's a matter of knowing what that is so you can start working on those risk factors today. These women should not be waiting until they're 55 to then look into their cholesterol and their blood pressure. They should be doing everything right from the get-go. They're exercising, eating well, keeping a healthy weight, blood pressure, lipids at check. They should be never holding a cigarette in their lives, and all these things need to happen for these women because it is taking a lot of young lives from us. We do have a program as part of the Women's Health Center to help minimize the risk in these women, and I believe Lisa will talk about that later. And lastly, the other condition I wanted to talk about that affects younger women is a situation called SCAD, which is the acronym for spontaneous coronary artery dissection. Anybody here has heard of that before? No? Okay, one person has heard about it. Spontaneous coronary artery dissection, or SCAD, is a cause for heart attack that affects usually young or middle-aged women. And it just means that the heart arteries that bring blood to the heart have a tear. These are usually healthy women with no cardiovascular risk factors. They never really think that this can happen to them, and then it does. I personally actually know 2 women in the past couple of years that had this condition, had SCAD, had a heart attack, and went for a run. Because they thought, I'm too young to have the heart attack. These symptoms may be something else. So they did not seek medical care at a very appropriate time. So I also wanted to leave that information with you because regardless of our age, if the symptoms are funny, if you're worried about it, you know, these things have to be in the back of our minds so we can actually seek medical attention in a timely fashion. So that's what I wanted to say about the younger crowd. And now let's talk about older women. Like I mentioned earlier, the estrogen during the reproductive years is protective to us, but once women reach menopause, the risk of having high blood pressure, having high heart attacks or strokes really increases significantly. For example, before age 45, there are more men than women that have high blood pressure, but after age 65, there are a lot more women than men that have high blood pressure. Why am I even bringing this up? Because hypertension or high blood pressure is the most powerful risk factor for cardiovascular disease in older women. In fact, in the world, throughout the world, is the #1 risk factor for death and disability. Even simple and very minimal increases in blood pressure, just 2 millimeters of mercury, can increase the risk for heart attack and stroke by about 8%. So it's important that women know that because the blood pressure needs to be very well controlled. The other important issue that happens more often in older women than men is stroke. Stroke happens in more women than men and also kills more women than men, and is most likely related, very closely related to this issue of high blood pressure in women. And lastly, I wanted to bring up the sex differences or disparities when it comes to heart attacks or angina. Angina is the medical name for chest pain that comes from poor blood flow to the heart. In this particular arena, there are just so many sex disparities, and I'm just going to tell you all of this, which is actually quite appalling. So starting even with the prevention side, women are less likely to be diagnosed with high blood pressure or have it treated. Women are less likely to receive a screening blood test to look for their cholesterol levels. And even if they do have high cholesterol, they're less likely to be treated with medication. A lot of it comes from the perception at the level of the healthcare providers that they are under a lower risk, which is not true. Not necessarily true at that age group. Then, once starting going from the prevention, but actually into the clinical manifestations, nowadays there's a lot of talk about women with heart disease having atypical symptoms, which I find so funny because the studies that were used to write the books that we study in medical school and the nurses study and all the healthcare providers, those books are written based on studies that included only men. So if you only include men in your research and you don't bother to ask the women, how do you know what are the common symptoms of heart disease in women? You just don't know. So it's not that we are atypical, we're just different, and now we are starting to perceive some of these differences. For example, women are more likely to present with pain that is sharp instead of the classic pressure that is described. They're more likely to present with shortness of breath for their heart attack, or maybe with gastrointestinal symptoms. Or sometimes there are up to 60% of women having a heart attack that actually have no symptoms to report at all. So there are these disparities which makes it difficult for the woman to recognize there's a problem, and also difficult for the healthcare provider on the other end to act upon it as well. Then once the woman is diagnosed with a heart attack, then these disparities continue. They are less likely to receive guideline-based medications for their condition. If they do receive these medications, they're more likely to bleed. And if they are hospitalized, they are less likely to be referred for an angiogram or to receive stents or to have coronary bypass surgery. Everything is worse when it comes to women. Women also die more from heart disease than men, and are more likely to have another one in a year if they survive the first event. So all of these things look terrible, they sound terrible, very doom and gloom. And I think there's a lot of it that we don't know about, right? So there's a lot of why this occurs that we still don't know, but we do have some insights into some of the reasons. First, women are older usually when they present. So just by the fact of being older, you already have a higher risk for complications. Second, because women are usually perceived as being lower risk or atypical, there is definitely a delay in diagnosis and treatment, which in itself can affect the outcomes as well. And for sure, there is really a paucity of sex-based research to guide us doctors about what is the best way to treat a woman with a heart disease or with a heart attack, or what are the treatments that we should not be using in women because they are actually harmful. these studies never really occurred. The majority of the science is based on men, and even when women were included, very, very few studies actually did sex-specific evaluation. So there's definitely a need for much more data and information to be coming in this arena, so we can actually provide the very best care to our women. So to summarize, I don't want you to think that this is all doom and gloom. We're all doomed to die tomorrow and this is going to be horrible, because I want to leave you with a very positive message, which is, even though these things are occurring, compared to where we were 20 years ago, we are lightning years ahead now. So if you actually look 20 years ago at the death rates after heart attack between men and women, they were separate like this, women and men. And over time, they've been kind of coming together, and the gap is narrowing. There's still a gap there, but it's getting narrower and narrower every day through significant efforts from the major societies, particular institutions, through education, through research, and events such as this one that really help bring this knowledge to you and help bring awareness and help you spread this information into our communities. So with that in mind, don't despair. These problems exist, but this is why we're here today, and this is why the Women Her Health Center exists, is to really continue to narrow that gap for us and really promote a healthier community for women. For men too, don't worry, we also care about our men. But today we're talking about women. So with that in mind, thank you so much for coming today and for listening to me, and I'll be happy to take any of your questions at this time.
Thank you, Dr. Coutinho.